specific questions. So let's just say the Democrats take back the House of Delegates, and
Okay, we're done.
let's say we
We're done.
let's say we controlled the General Assembly and the governor's mansion. What would we push for in healthcare, other than Medicaid expansion? Is there anything else that you would want to push for? I mean, some states are trying to play around with single payer. Vermont's played with that, and other things besides that. But would you have anything else on your healthcare agenda besides Medicaid expansion, which of course is super important? But any other priorities in the healthcare area?
I'm sure that there are, and there's more discussion about those, what steps we would take after. I think the first hurdle is getting Medicaid to be expanded across the Commonwealth. Baby steps, Lowell.
Baby steps, okay.
Baby
Well,
steps.
we'll take it at that.
And then,
Yeah.
you know, then we'll talk about the other services that we need to work on.
Yeah, one of the things that I know Hala's spoken to and Ralph Northam's spoken to very powerfully as well is specifically the gaps in mental health coverage. This is something Senator Creed Deeds has spoken on and really been able to try to build some bipartisan support for. It's something that knows no class lines, no cultural lines. This affects all of us. And Medicaid in Virginia, I can say, is coming from I'm the son of a pediatrician and the brother of a pediatrician. In addition to our expansion problem, we also have one of the lowest reimbursement rates in the country, and that really affects the quality and range of care. So I think, you know, within the Medicaid expansion, one of the things that there's a lot of interest in doing is making sure we have enough people moving into professions around mental health and around addiction. And the interesting thing about that is that involves people at all levels of training. It's people with doctorates, but also people who can get a 6-week certificate and be part of the home health care where we have enormous gaps, and particularly when those become living wage jobs. I mean, there were over 200 jobs in Charlottesville last year that paid over $28,000 a year, which is actually what $15 an hour is, that went unfilled. And the certification program to get those jobs was only an 8-week program at the community college, not even a 2-year degree. So we need to figure out programs. This is why I know Ralph Northam's proposal is so exciting about up to 2 years of debt-free community college, is creating those kinds of pathways. So in addition to the Medicaid expansion that Hala is fighting for, I think there's a lot of interest as well in debt-free pathways to fill some of these desperately needed positions, particularly in areas that include addiction services. And
Right, and that gets at the opioid crisis as well, which is ravaging a lot of actually red areas of Virginia.
Correct.
Yeah. It's yes. You know, yes.
Okay.
I was going to share, but I was like, yeah.
Well, it's in Prince William County too.
Yeah.
Well, yeah, and we, you know, again, we go back to, we have to start at square one. We have to work at expanding Medicaid. We want to, and that's not the only thing, we want to work at affordable education. 2 years would be great. My son is in college now, and even in community college, you're just like, oh my gosh, I'm a single mother of 2, and that burden on me economically, and I have to pay back these student debt loans for my son because that is the only pathway that he had to college. I mean, just the financing portion of that. We had an ombudsman program that would have allowed Virginians to refinance their student loan if we couldn't get to the 2 years for a college at a much lower rate, taking the burden off of families like mine. So that is another avenue too, that we, and teacher pay, education, vocational options, pre-K. The list goes on, and they're not just buzzwords, they're actually impacts on our everyday families.